Hi, good evening and welcome to tonight's webinar. It's Tuesday evening. My name is Andrew Ormerod and I'll be walking you through the Clinical Skills app tonight. It's quite strange because I normally facilitate the other webinars and have a speaker on board. However, despite it saying it was Martin Rolls tonight, it's actually myself who will be presenting the webinar. And so we're going to be talking about the Clinical Skills Log tonight, both the app and also the dashboard, which I'm surprised a lot of people still don't know that we have a dashboard where you can actually customize the app. And so we will be going through the facilities and I'll be showing you briefly how to customize the app. What we will do is it should take us about 15-20 minutes to go through the app and the dashboard, and then we'll have some questions and answers, and I'll also tell you what's planned on the updates that we have planned to launch later this year. And so I'm guessing some people on here tonight might already have the app. And so on your little control panel dashboard, if you quickly pop your hand up, you should have an ability to pop your hand up. If you click on the hand icon, it will just let me know roughly how many people have got the app and how many people haven't already. And so you just click it and I'll give you a quick look at. So we've got about 120 people on tonight, and by the look of it, about 110 have got the app. And so with a few people who haven't got it yet, it is available on both iOS and on Android. I do know that we had some problems initially with Samsung devices, but as far as I'm aware, that should be resolved now. And as I said towards the end, you can actually either type a question in and I'll read the question out and try and answer it to the best I can, or indeed, if you want to, you can hold your hand up later on and we'll open your microphone up and we can have a discussion and you can give me some feedback about the app, which I'll then take back to the panel. And so the landing page for the Clinical Skills app is where you can download the app, or you can go onto the iOS or Android website and search for Clinical Skills Log. I think even on Google, if you search the word Clinical Skills Log, if I'm not mistaken, it should rank all right. It is kindly sponsored and supported by Medtree. Medtree have kindly sponsored and supported all the costs of the running and the server and the updates, and so I would like to thank those for their continuing support, Jonathan and the guys. And so you can find it very easily by doing a quick Google search, or indeed you can just go to clinicalskillslog.co.uk and you can find us from there and download the devices. The app is really simple. I've got an iOS device. What I am going to try and do now is I'm going to try and stream my phone onto the screen, and this is sometimes where it all goes dreadfully wrong. However, you will have to just bear with me. I shall hopefully be able to screen that onto the screen, so you should be able to see my app on the screen. So I've downloaded the app, and you have two ways to register. You can either register on the app, and so you set yourself up with an email and a name and a user account, or what you can do is, if I just quickly jump onto the website, if you scroll to the very bottom of the website, there is an ability down here to create an account, and what's required to create your account is simply your first name, your last name, an email address and a password, and that will send you a login detail, which you can then use to log into the app. If you have forgotten your password, you can click onto the forgotten password at the bottom, or you can even change your password, because I know what the system does do is it sends you one of these gobbledygook passwords that are very difficult to manage, and so you have got the ability very easily to change it from there. So if I click back onto the app, so the idea of the Clinical Skills Log was from research done with the RAF and Andy Thomas from up the northeast, and what they wanted to identify was skills that were being used in RAF medical practice, but also skills that weren't being used. And so what the basis of the app, or the research behind the app, was initiated to very easily identify skills that were being used all the time and that individuals are very competent at, but also to identify skills that wasn't being used, or skill decay, or things that could be identified for continuing professional development. And thus was born the Clinical Skills app. It's just coming up for 2 years old, and we haven't really made that many changes to it. And that is almost intentional, because just like the research we did with the RAF, obviously we've brought this to the civilian market. We've learned lots of things from what we've gathered already information-wise, and we know what is required to bring the app up to date and make it suitable for the future. And one of the reasons we brought the app to the UK market was because of the coroner's ruling that indicated that anybody who was using airway manoeuvres in the practice of paramedic or professional had to record their clinical skills themselves. And so most ambulance service trusts within the UK would provide an airway log or a paper log that you would keep in practice, and you would document specific pieces of kit that you'd used in for example, intubation during a cardiac arrest. Now, if you're anything like me, because I work as a specialist practitioner, I am absolutely terrible at keeping paper records and then putting it in my pocket, bringing it home. It gets bashed around in my uniform all day, and the probability is in 3 months' time you wouldn't be able to read any of it. It will be illegible or simply just destroyed through being bashed around in my pockets. And so one of the reasons we brought the clinical skills app to market was the ability to record my airway interventions and keep an electronic record that I could access whenever I needed to, and also use it to identify skills that I hadn't specifically used over a period of time. So this is the home screen of the app, as you can see on the computer, and you have two ways to document skills. You have the ability to start a new shift, which almost gives you the ability, if I click on to start a new shift, it asks you for the shift type, and this ability has got lots of drop-down options. I know there's an option to free text, and on the new app that is coming, there'll be an option for you to remove things on there that are never going to be applicable to you. And so if I click onto NHS, because I work in the NHS, you then have the option to shift to document shift length. And so I know the old cliche I always get, we never work 12 hours, we always turns into a 14-hour shift. But ideally, if you're working a 12-hour shift, I would suggest that 12 hours is what you would document. Because what will happen at the end of the shift, you will be emailed a summary of all the skills that you have used within that particular shift. And that's for two reasons, really. One of them, it gives you the options to delete a specific set of skills if you don't want that particular job documenting. But more importantly, it's almost just like a complementing summary of what you've done over that shift. And from that, you can either archive it or you can simply just delete that email if that's required. I know some people said they didn't want that email sending after each of the skills or after each of the shifts, and when we jump onto the dashboard, I will show you how to disable that, because I know it is annoying for some individuals. It also asks for the location, because there's lots of different options in there, whether you're working on an ambulance, in a medical centre, in a walk-in centre, and this is for two reasons, really. Number one, it demonstrates the capacity of which you carried out these specific skills. But number two, it also gives us a bit of an idea of where this particular skills app is being used, because we have got tens of thousands of users in circumstances and situations that we never anticipated this app would be used in. What I can also tell you is that on some of the future reports, you'll be able to specifically request that if, for example, you're a paramedic practitioner and you work in a walk-in centre, you can request only skills that were used in the capacity of working within a walk-in centre environment. And so I'm just going to select a good old ambulance on there, because I don't like to break the mould. And then if I click on to begin, what will happen then is that this shift will continue to add all these skills to that particular one shift. Now, unfortunately, on this particular app version, you can't end the shift prematurely. It will automatically end after 12 hours. And so an alternative to doing this or creating a shift is simply to add a skill set with date. Now, as you can see, it's picked 8 minutes past 8, which is live now, and it's also put the date format in there. You can change that. If you click onto it, you can see the option now has come so that you can change the date and also the time, which is really useful. So, for example, if I did an intubation on Saturday and I forgot, because of the dynamics of the incident, to record it, I can backdate that particular set of skill to that incident by using this facility. And so I'm going to just quickly click on to next, and then it's going to go through patient details. Now, again, we've had lots of feedback from practitioners who perhaps aren't working pre-hospital who said this is very structured around ambulance work. Well, of course it is, because I'm an ambulance man, and so that was the research gathering of this is what this app's going to be used for. What I will tell you again is on the future update, you'll be able to customize this for no matter what profession you're working in, whether you're a paramedic, whether you're a nurse practitioner, whether you're a consultant anaesthetist, you'll be able to customize it. Starting at the top, incident number is really important. One of the reasons we put an incident number in there, and certainly for the ambulance airway log, it will only pull details into the ambulance airway log report that have an incident number, and that's so that it can be traced in the event that there is an an audit or in incident working analysis, or a problem's occurred and you need to track that specific airway intervention, there has to be an incident number. If you don't want to put the incident number from the job there because you're concerned about data protection or data breach, you can simply just put a reference that you would be familiar with and that you'd be able to identify that particular event. But there isn't a place on here to put patient identifiable information, so you shouldn't be really putting anything in there that can specifically identify a patient, reverting back to Caldecott guidelines, of course. So I'm just going to put a mock incident number in there. So I'm just going to put 1, 2, 3, 4, 5, 6, 7, 8, 9, 9, 9. The next option is the call type. And again, there's lots of different categories in there because we've realized and made some additions that actually this app is being used in lots of different capacities. And so the specific call type there is, you've probably seen I've edited one at the bottom. I've put soup kitchen, and the reason I've put soup kitchen in there is because we are finding paramedics are doing placements in soup kitchens, ironically, and even though they might not be carrying out specific clinical interventions, they are still in that specific category. And so what I'm going to put here, I'm going to put a maternity emergency unit, just because I've customized this app a little bit already for my last placement. The nature of patient, lots of categories in there. And what the app will do is it will specifically and dynamically change the next set of questions based on what you put here. So for example, if I click onto cardiac arrest and click done, you'll notice the next box underneath then is starting to ask what the mechanism of that specific cardiac arrest was. If I click back into the cardiac arrest and untick it and tick onto maternity, you will see the next set of questions has changed to a set of maternity related questions. This again will be customizable, but the complexity of the clinical skills app meant that there was no way around other than this linear element of having these drop down boxes. And again, there's a reason why this clinical skills app has been so popular, is that it's very detailed and in depth. And so when someone has made a suggestion perhaps for an additional section adding within the maternity, we've been able to add that without a physical app update through the App Store or through Google Play. And so the next one is age. Now, again, this catches some people out because one of the questions is, how do I document something that is less than 1? And that's something we never anticipated in the initial build of the app, but it is really easy to manage. If I type in there 0, you'll notice the box underneath then drops to month. If I drop in there 0, you'll notice it then drops down to days. And that is the way we've got round it at the moment. On the app update, you will be able to select specifically right down to weeks, days, months. However, if you need to document a pediatric or a child, that is the way you would do it. Simply put 0 age, as in years, which will drop down to months. If you drop that down to 0, it will drop down to days. And so I'll just take that out of there, and I'll just put in there 55. The gender, again, we've had some feedback in there to include things like transgender or non-disclosed, and we have that ability. The reason it was done initially was because we use this as part of the research capture, and so we selected either male or female, because one of the things that you'll be able to create in later reports will be the ability to select just male patients who, for example, have been dealt with in a major trauma environment, or female patients who've been dealt with in a self-harm or a mental health issue. And so the specifics of the reports will be very specific to, in the future, male, female, transgender, other, or you'll be able to put your own categories in there, whatever patient groups you come across in practice. Patient condition category, again, there's lots of drop downs in there, lots of acronyms, and I do try and stay away from acronyms because sometimes medical people get very tied up with them. But the CBRN, CNS, CVS, ENT, there is suggestion that we do put the full titles in there for people who want acronym wise, but there's lots of acronyms in there, and there's also lots of categories. So I'm just going to put on here CVS, cardiovascular system. And then care pathway, 2 care pathways predominantly. One of them is hospital, and if I select hospital, you will see down below is then direct ward admission, emergency department, major trauma unit, medical assessment unit, all the things generally you would find in a hospital unit. If I untick that and I click on there pre-hospital, then the options are community referral pathway, which we're seeing lots more of now, certainly in pre-hospital and ambulance settings, deceased, discharge, no treatment required, falls team. And this is not designed to be a patient report form. It is designed for your learning and development to identify where perhaps you're sending patients, what specific skills you're using with a patient set, things that you would hope you could probably pull from an ambulance service patient report form, but some trusts can do that, some trusts can't. But this is your own personal record. So again, in future updates and reports, you can identify how many GP referrals you've done that you actually didn't have any clinical intervention with. So you didn't give any paracetamol, you didn't give any ibuprofen, you might have just given self-care advice. And so the details of the reports in the future, you'll be able to tap down right down to specific verbal communication, or worsting SOS advice only. So we're going to click onto hospital on there. So untick there, click onto hospital, and I'll click onto the emergency department. Click onto next. And then the options are CABC, basically, catastrophic hemorrhage. And I don't probably need to go through all these categories, but there's lots of things on there. There is an option to put free text in most of these categories, and somebody has reported back that sometimes the free text is not appearing on the reports. That's fine. What I would suggest is you continue to put your free text in, because the new updated reports that are going to be launching will pull that free text into your report and put it into an additional text box. And so don't think it's lost. It's not. You will be able to pull that free text in. So anything you add will be able to pull through onto future reports. And then it goes through the airway, breathing, circulation. And if I click onto endotracheal intubation without drugs, you'll notice then it's very specific. So again, the app understands endotracheal intubation without drugs, and it then starts asking me what specific pieces of kit I used in that context. Was it successful, yes or no, and how many attempts did I use? And that specific piece of information on there will be included on your ambulance airway log. And so what I would suggest is you try to be as detailed as possible, putting things in there that perhaps you did use but wouldn't consider to always be recalled on an ambulance airway log. Just because the more details in there, the more likely you are to recall that specific event. Certainly if you've had to get an advanced paramedic and someone's had to come and do perhaps a surgical airway. You can see that because I've ticked more boxes, there is more options down here now. So it's asking for surgical airway. What did I use? Standard kit, scalpel tube. Was it successful? Yes, it was. LMA. Was there an air leak? What was the reason I went away from the LMA to endotracheal intubation? And was it successful? Yes. So lots and lots of details there. And I know it's very linear and there's lots of tick boxes, but actually, in reality, you'd probably get through this quite quickly. I'm only taking my time for the purpose of the demonstration. The next one is a breathing assessment. And again, lots of categories on there, and also an option at the bottom. So for example, if you choose certain categories on here, there will be more options that are available. So for example, different types of needles you've used, with needle decompression, resuscitative thoracostomy. So the more options you choose, the more questions it will ask you based on them choices. And then again, it goes through circulation, disability, pain management, spinal immobilization, splintage. There's lots of things on there perhaps you wouldn't use pre-hospitally, and I'll show you how to disable those in a second. Minor injuries, again, lots and lots of feedback from nurse practitioners and other people working in the capacity of pre-hospital roles that do specific things that aren't on the app, which will be able to be added shortly. I'll show you how to do that. Wound care, plaster of Paris, non-technical skills. And so on the non-technical skills, there's things on there like cardiac arrest team leader, handover at MIST, operational commander, trauma team leader and such. And then drugs administered, and again, there's a long list of drugs in there. Some of them that are applicable within paramedic practice, some of them that aren't, because we have lots of doctors who are using this app at the moment to document advanced airway management. Click on to next, and it gives you a little summary of what you've documented. At this point, you can go back if you're required to do so, and you can make some amendments and changes. So it's almost a summary of this specific category, what time it was, what day it was, and you can see because I've got an incident number on there, that the probability is it will appear on my airway log. Click on to submit, and it says your entry has now been securely submitted. If you click on to share, I think it sends an update to Twitter to say you've just updated your clinical skills log of such. But you click on to OK, and you can see there now that's on my screen. It gives me a summary that I've carried out 6 skills, and in the past 60 days, in the past 30 days, I've carried out 6 skills. So if I wanted to add another set of skills now, or another incident, I can simply either click Add Skill Set with Date, or I can start a shift if that's the case. So what you can do is you can click onto the report, and you have two reports. One of them is a graphical report, and we describe that as a breakdown of skills used over a set period of time, and it identifies areas of potential improvement. And so this is very graphical and very aesthetically pleasing to the eye, you could sort of say. We have 20 new graphical reports that we have been trialing and are ready to launch. And if I click onto graphical report, this one's very specific, I think, to airway. If I click onto create and I'm selecting my date periods, you'll see very quickly it pulls that information and it gives me a quick synopsis of what I've done over a period of time. And so people tend to use this, and once a month they'll pull this off and they'll upload it through CPD.me, and you'll use it as part of their continuing professional development. One of the things that we took away from the RAF research was the ability at the bottom, you can probably see, is my 5 most documented skills within this period. So airway assessment, airway manoeuvres, endotracheal intubation without drugs, head tilt chin lift, and end-tidal CO2. So there are 5 of my skills that I'd use most of the time within this app. However, if you look to the bottom, you will see it also identifies 5 least of my skills within this period. Now, this again was the pinnacle of the research. Was this app, as long as you use it regularly, will help to identify skills that perhaps you don't use all the time. And so your McGill's forceps, things like your frac packs and your splints, things that's normally in workplace or in your ambulance or your place of work that you don't particularly use all the time. And this kit or this specific reports will identify specific skills that aren't being used, or that at least you haven't documented are being used. If I click back on done and I go back to the reports, the descriptive report, again, very, very technical, and it's took us a long time really and a lot of research around the last 2 years to capture what is available and what is not available and how these reports are going to work for the future. But if I look specifically at just creating an ambulance airway log, I can choose my 2 date periods from the top and I can click on to create. And what that will do is it will only pull information that relate to an ambulance airway intervention with an incident number. And so you can see from there that down below I now have a very long detailed list of advanced airway manoeuvres. And so you can see from there I've picked a 12-month period, and I think I probably have 18 advanced airway interventions there, and it gives you a little synopsis of what the incident was, what the patient category was, basic airway skills used, intermediate ones, and also advanced ones, and whether you've used end-tidal CO2, which again is proposed you should be using all the time now in endotracheal intubation, and also what the outcome was, and any free text that's included in there. And so there is lots of different reports. What I will tell you is that if you select all of those boxes, it's quite in-depth and it does use lots of processing power to pull off all the reports. And so if I select a few from there, you'll see that it does take a little bit longer to sometimes pull that information. And again, depending on how good your internet is, depends on how fast this report will pull. But you can see it's taking a considerable lot more long time, but the report is a lot more in-depth. We are also aware that sometimes it's glitching and it's not pulling some of the information through. And again, these are some of the glitches that we have fixed for the up and coming updates that are proposed to come and launch towards the end of the year. If you click onto the top left-hand corner of the app, you can go into the menu settings, and from there you can edit your profile, so you can change your skill-based level. You can also click into settings, and from settings what you can do is you can hide some of these sections, so you can't edit them from within the app at the moment. However, what you can do, so for example, if you just want to use this app specifically for your airway log and you don't want to document all the other things that we've gone through and demonstrated, you can hide them by simply just getting rid of these sections, and it won't delete them altogether, it will just make them hide from the section. So I'll probably leave breathing in there, but I've took out catastrophic hemorrhage and the other categories apart from airway and breathing. If I click on to save, that will then, if I add skill set with date, I'll just put a quick incident number in there, just allow the airway and the breathing, and then that will be it. And so that's a very quick way just to very, very quickly chop out some of the sections that perhaps you might not want to use. Now, we did get some feedback and some of the feedback was we want to be very specific and we want to take out some of the things that are not being used at all in practice, or indeed aren't within my specific scope of practice. And so in order to do this, what we did is we created a dashboard. And so hopefully if I jump onto my main screen, you should be able to see my dashboard. So how do you find the clinical skills dashboard? You should have had an email when you downloaded the app to say that you have a dashboard, and the dashboard is where you can customize it. Or if you just do a simple Google search and you type in the Google search clinical skills dashboard, it should find you at the very top the login for the clinical skills dashboard. Really simple. Once you click onto that, you use the same login as you have for the app. If you've forgotten your password, you can click onto forget password and it will send you a new one or a reminder, and you can log in. So you can click onto login, and this will look pretty familiar. It's almost like a big version of the app. And so what you can do is, if you don't specifically want to go through with the app, or you've got lots of skills that you want to backdate, you can use the dashboard to do that, because what it does is it gives you a little synopsis. So I'll walk you through from the top. You have an overview, which is this dashboard, and that refreshes, and that tells you how many skills you've done. So again, it's a mapping that's pretty much the same as what it says on the website, on the app. It has got an option to view all your entries, and so that will give you a list of all your specific skills entries, and from there you can edit, you can view them, or you can delete them. I will tell you, if you click onto delete, you get one warning. If you click on that, it is gone forever. There is no way we can possibly recall it, and so it is nice and secure. We have the latest encryption, but once you delete an entry, we cannot recall it back for you. You can then click onto shifts, and you can see all your shifts that you've used, and also your length of shifts and what location. And again, you can delete that entire shift, and that shift will disappear. In the settings, it's a little bit more technical, and so 3 sections here. You can see on the first section is, I don't know if you remember when I referred to at the beginning of the webinar, you can disable emails. So this 2 options are, if you want an email summary at the end of the shift, click onto on and you'll get that email summary. If you want an email summary after every skills entry that you submit, and this psychologically is almost like a pat on the back, like a well done, this is what you've done, you can click onto on. So every skills entry that you submit, you will get a copy or a synopsis of what you've done. If you don't want them, click onto off, and you won't get them any longer. And in the new app that launches, you'll have the ability to disable them in the app also. And then you have this middle section, and this webinar is being recorded tonight, so if this looks really complex and you think, I don't really get this, Andrew, I'm struggling, worst case scenario, you can drop me an email and I can try and help you via email, or I will send you a recording of this video so you can see how you do this. So if I want to specifically edit my airway section of my app, and so I'm going to try and stream this back onto the screen for you. Let me try and flick it back up onto the screen. Nope, it's not letting me. Oh, let me try again. There we go. So let me just click onto there, so you should be able to see everything now. So if I click onto the airway section, you can see that in the app I've got airway assessment, airway maneuvers, and there's some options down there for free text. If I want to put something into the app that I want to use all the time, and I want the ability to just tick it as an option, if I click into airway in this section, I have these options here to edit. And so what I'm going to do is I'm going to click into endotracheal intubation without drugs, and I'm then going to perhaps untick things in there that I don't want, so are not applicable. But more importantly, what I can do is if I just get rid of all these options, and I'm going to put in there a specific option that is very specific to me. So I'm going to make one up. So I'm going to call it Andrew's Magic Airway. And that, in layman terms, is sometimes just encouraging them to take a big deep breath when the sats drop a little bit low. Click on to save, and that will save as an option in my app. And so if I bob my app up onto the screen and I restart it, I think you've got to restart the app for this to occur, so I can quickly do that. If I then click into my skill set with date, click onto airway, click onto endotracheal intubation without drugs, there we go. So it then becomes an option within that category. So you can see all the things that I have disabled. So if I click back onto endotracheal intubation, all the things that I've disabled apart from bougie have disappeared, but Andrew's Magic Airway has appeared. And so that allows you to customize and put in there very specific skills that are specific to your scope of practice. But more importantly, what it does also allow you to do, if I quickly click onto cancel on there, is if I click onto circulation, so for example, it also puts options in there that are very specific to you. So if there is a specific thing that you want to document within your scope of practice, you can add them in there and it will appear within your airway or your breathing or your circulation log. Now we have to be very careful because eventually what you could end up with is a very complex and complicated app that becomes so hard work to use that you simply wouldn't bother using it. And so just be very mindful when you start to edit some of these categories. What you can do is if I click back into that category that I've added, is I can click on there and I can remove the selected airway. Click on to save, and then that is no longer an option. But I have to restart the app for them changes to take place. I've just looked there and it's not. Let me actually just cancel that. So you do need to restart the app for any of the changes to take place. But the smart thing is it doesn't require an app update, which is one of the genius reasons why we created the Skills app, because you can virtually customize your own specific app based around your own fluid practice. And so that is how you do that. If you are struggling, I know there's some questions that come in, will this video be available? It will be available. We'll probably publish it on CPD.me, so the same place as you registered on the webinar. We will pull it in there. So where you've registered for tonight's webinar, we'll put the recording in there like we do with the previous webinars. And so don't worry, there will be a copy of it available for you. What you can also do on there is you can update your profile and you can also change your password. So what I would suggest is you change it to something a bit more memorable, because it is very difficult to remember those gobbledygooky passwords that do get sent out or generated by the system. It's probably a good point now to mention that some people have asked, how do we change our password, or how do we change our email address, sorry. We have considered this, and it was almost an afterthought because we didn't realise that sometimes people would change ambulance trusts or change trusts and not be able to access email. We can change your password and email for you, but you will be required to send us proof that you own both email addresses. And so if you click onto the guide, at the very top of the help page is how do I change my email address. And so from there, changing your email address is really simple. Just request a support ticket and tell us your old and new email address. But what we will do is want you to verify that before we allow you to have access to your skills. The new app will send you text message verification, so it will be far smoother and easier for you to change your email address. But currently, if you do need to change your email address, we can do that for you. Normally takes about 12 hours, but just send us an email and we can do it quite easily. So you can update your profile, you can change different levels on there, and again, there's lots of categories and the option to put free text in there. Change your password. You can also add a shift from here, so you can, again, if you're working from a computer rather than an app, because one of the things people said is we don't have a smartphone, so how do we use your clinical skills app? Well, you can use the dashboard, so you register and just use a web-based dashboard, and you can have the options here to add shifts, and also you have the option to add in their skills. So again, you can put a specific set of skills in there and it will virtually go down an entire list. And again, it will develop as you start to pick categories. It will change and the form will change dynamically depending on what you've done. Clicking back up onto the overview, what I can also do from here is generate reports. And so initially, the new graphical reports, the new textual reports will appear in here. And so you'll be able to select graphical report, and then you'll be also able to select a specific graphical report. So, for example, cardiac arrest, managing discharges in the community, managing patients with trauma. There'll be lots of different graphical, I think they call them infographical reports that you'll be able to select from here. And then you can choose the date, both from and to, and then you can download that and print it off and use it as part of your portfolio and development. I appreciate we've gone over. I said 20 minutes, didn't I, with questions and answers. However, we're up to 34 minutes. And so at this point, I am going to give you the option to ask some questions, and I'll be more than happy to answer them, or even open your microphone up. So if you do want to ask a question verbally, you can put your hand up and I'll try and open your microphone, as long as you've got a microphone on your computer, that is. Or you can type a question in and I will be happy to answer the question for you. So you type your questions in by just where the little flashing cursor is. It says type question here. Just type your question in there and click on send, and that will come through and we'll read them out. Richard has asked, will a video of this be on CPDME YouTube channel? Yes, it will, Richard. And again, as I said, it will also go onto the webinar booking page. And so you'll be able to click on there and you'll be able to watch the video back. We will be having another one very shortly, because we plan to integrate the infographical reports before we do the app update, just to get some feedback from you guys, because it's really important that we get feedback so that I can feed it back to my innovations team, and also feed it back to Medtree, who obviously support this project and the dashboard and things. And so feedback is really important, guys. Even if it's constructively critical, please do send it in, because without you guys telling us what you want, we probably wouldn't make any changes to that, thinking that it's perfectly fitted for practice. The next question from Robert, can I edit the call types? Sometimes I work on private events. You can, as far as I'm aware, Robert. I think if you click into settings, you can, if you click on the patient details, click on call type, and I think you can change it. Like I've put in there, soup kitchen, you can remove them. Disable the options of the obvious green 1, green 2, green 3, which is a very specific ambulance calls, and you can put your own in there. And so again, it's very difficult for the reporting side, Robert, because it pulls information into set reports, and so if you start putting things in there that we don't know about, sometimes the reports will be a bit disjointed, but it is good to feed that back to us and do let us know if that occurs, and so we can look at changing some amendments. But as I said, I am finding paramedics now are appearing in soup kitchens, and even though you're not going to learn how to intubate someone in there, what you do start to build upon is your effective communication skills, and also looking at social issues and alcohol and drug abuse, etc. And so you can disable, as I said, Robert, all the default options and then add in their specific calls. So I know certain ambulance trusts have changed all their response codes, and again, I think the specific trust I work for are going to change ours shortly, and so I can change them myself, and they will appear specifically in my own personal app. And again, the next question was yours, Robert. Thanks very much. That's good feedback. What about mill exercises, i.e. training events? Well, I will tell you what we have just been working on. We have a couple of universities who are currently wanting to use the app as part of their faculty. And so the idea is they will be able to have a dashboard very similar to this and customize specifically skill sets for their university monitoring. So, for example, to be registered as a HCPC professional, they will require you to carry out certain sets of skills. And so what we can do, and this is with my commercial hat on, is we can create a customized dashboard for an organization, for a military group or a specific group of first responders, that you can then issue username and passwords, and the username and passwords can then be monitored, and so it almost becomes an implied content. So your group can then be monitored and their skills can be monitored, but more importantly, you can identify skills that are being used all the time and competently, but also skills that perhaps aren't being used, and that might lead to you perhaps putting some training or learning and development events on. And so we are currently working on that. It's being used at the moment in trial. One of the things, again, when you refer to training events, one of the things the new app will have the ability to do is capture signature and information of witnesses. So specific students who want to use this as part of their generative report or formative or summative report for their university placement can capture the signature of the mentor who's witnessed a specific set of skills, and that can be included in a specific student report that we plan to launch on the next update. And so again, if you are being mentored and you capture a skill or allowed to carry out a specific skill within your scope of practice, your mentor can sign to say that he's witnessed that specific skill, or that is in that specific piece of kit used within a scenario. Another question come through from Brian. Brian's asked, how do I change my email? All you simply need to do is just click onto the help. So from the help, you can either get to it from two ways. You can either get to it from within the app, or at the very bottom of the clinicalskillslog.co.uk page, we have need help. Click here for our knowledge base, frequently asked questions, and that will pop up there. Type in there, how do I change my email? I have to excuse my terrible spelling. And the answer there will come up to you, how to change my email address. So literally, you send us a request to change it. As long as it's come from the email address that the app's registered to, we'll generally change it for you. But occasionally we do ask that you send us an email from the specific email address you want us changing it to, just as an added measure of security, because you probably know that us guys here from CPD-Me and the Clinical Skills app are really tight on security. And one thing I am very protective of is looking after your information safely. And so I don't want it to get into the wrong hands, which will cause us both problems, no doubt, down the line. Do we have any more questions, or anybody not sure about any element of what I've showed you tonight, or anything you would like to specifically see in any coming updates? If you don't tell me via this live webinar, don't worry. You can always email me at andrew.ormerod@cpdme.com, and I will happily answer your email as soon as I can do. One of the questions that I haven't been asked tonight, which I'm quite surprised from all the attendees who's kindly joined, is will there be an ability to link CPD-Me with the Clinical Skills dashboard? The answer, in short, is yes, there will. We're planning on a new website launching shortly, so CPD-Me will be having a new website and also some new mobile apps. And so we're looking at the security token of how we're going to let them all talk to each other, knowing the same person and the same email address. And so we are just working on that. We have trialed it and it does work, but again, I'm very protective, and so I like to do 3 or 4 trials and make sure that the system doesn't flop and cause any problems. And so there will be an ability probably later this year, June, July, for the clinical skills log reporting to be integrated. So when you create your professional portfolio from CPD-Me, it might also ask you at that stage, do you want to include clinical skills within this period of time to be included within your CPD portfolio? We have just got yes, it will. William, we have just been asked that question twice, actually. When pulling out information in a textual report, especially airway management, unrelated info gets pulled out. Will this be fixed? It will. We are aware of that glitch, but what it does require, William, is an app update. And so we don't specifically want to update everybody's apps until we launch the new app. But yes, it will. It might be worthwhile if you haven't already told us about that specific glitch, William, just so that we can get the IT guys to have a look at it and make sure that it is on the fixed list for the upcoming updates. Guys and girls, I have kept you for 40 minutes tonight now. I am very, very grateful of that, but I will quickly point out before we go that we have got some really good webinars coming up shortly, and they are all what I refer to as FOC, free of charge. If you are a member of CPD-Me, of course, you do get a certificate of attendance that drops directly into your portfolio, which makes it nice and easy and smart to manage it. What I will also point out is there is a few good CPD events coming up shortly. Just a quick Google search for you, but my friend Terry called me today because Life Connections has just come onto the agenda, and so it is based on the 6th and 7th of June at Telford, and there is a great programme lineup. There is 4 programs, one for pre-hospital first responders, one for first aiders, one for pre-hospital airway management, and I think there's a paramedic one, a resuscitative one. But please do have a look at lifeconnections.uk.com, or we'll be sending some posts out very shortly in relation to some of the offers that we're going to negotiate with Terry, hopefully for members of CPD-Me, so you'll get a good early discounted offer. Again, without pitching too much out, if you go on to Trauma Care, they've also got some free webinars now. So click onto CPD events, trauma care webinars. What I do know is that they are filling up really, really fast. And so I think Caroline Leach has got one this month, but I'm pretty sure it's booked up. Yep, it's 120 people and it's booked up already. And then I think we have one by Jason Smith, and it's got one space left on it. And then that's full. But I do know that sometimes they do release some more spaces, and so lots of free learning and development opportunities for you there, guys, from some good quality learning resources. But if you do have any questions after tonight's webinar, again, andrew.ormrod@cpnb.com, and I'll be more than happy to assist or answer any questions. All that leaves me to say is thanks very much for taking part in this webinar tonight. As I said, I will make the recording available to you, but do have a log onto the dashboard, Clinical Skills Dashboard on Google. You'll find it. Use the same login details as the app and have a play. You can't really do too much damage, but don't delete things that you need to keep, because you won't be able to get them back. Thanks very much for joining the webinar tonight. And if you are at work, stay safe. If you're off, then enjoy yourself, put your feet up and watch a bit of television. Good night. Thank you.